Okay, so I talk.
Okay. All right. Too much brain to contain is a funny slogan for a serious condition. This condition is called a Chiari malformation. I'm going to be discussing type 1. According to Conquer Chiari, Chiari is a serious neurological condition in which the back part of the brain, or the cerebellum, actually descends down through the skull into the spine, putting pressure on both the brain and the spine, causing many symptoms. This is a neurological condition that's recorded about 1 in 1,000 or 1 in every 2,500. According to recent studies, it's only found on MRI imaging, and it has been much more diagnosed lately than it has in the past. There are several types of Chiari, although I'm only discussing type 1. Type 1 is considered a herniation of the cerebral tonsils of 5 or more millimeters. This blocks the flow of spinal fluid and creates a long list of symptoms. Type 2 is considered classic Chiari. This is present at birth and it's often associated with spinal bifida. Type 3 is considered to be the most serious form of Chiari. It's whenever you actually have the herniation out and it creates a pocket outside of your body. And then type 4 is also very serious, and it has to do with either a deformed, missing, or misplaced cerebellum. The last two are not compatible with life and usually end in death or premature end of pregnancy. There's also something called Chiari type 0, which is similar to type 1, except it's a herniation of less than 5 millimeters, but it has to cause symptom to fit the criteria. For symptoms, according to the ChiariCare.com, the symptoms occur in a slow and insidious manner, meaning that it may occur over weeks, months, years, or decades, and is often misdiagnosed. According to the AMA, it usually takes about 5 years between the onset of symptoms and your diagnosis. The symptoms really vary widely. There's about 192 known symptoms to Chiari, most common of which would be a headache. But it's not like a usual headache because it's actually a buildup of pressure within your skull. And so this would be a headache that occurs in the back of your skull, wraps around your head, and settles into your eye or sometimes your ear. So that would be the most common, affecting 90% of patients. But according to the NINSD, the other most common symptoms would be dizziness, muscle weakness, seizures, incontinence, vision disturbances, hearing disturbances, ringing of the ears, and many more. There's many associated disorders and diseases to Chiari. These would be probably the most prevalent. The first being hydrocephalus, which is the increase of fluid within the brain. The next would be POTS. It's called postural tachycardia syndrome. That's whenever a patient would go from lying down to sitting up and have a rapid increase in heart rate. There's Ehlers-Danlos syndrome, which is a connective tissue disorder. Intracranial hypotension, which is actually whenever you don't have enough fluid within your brain. That's usually caused by a spinal fluid leak. Spinal bifida, epilepsy, tethered cord syndrome, which is a tear or kink within the spinal cord. Or syrinx, seen here, which is a cyst within the spinal cord, which might be small or could actually extend the entire length of your spinal cord. According to ASAP.org, the first step after diagnosis would be to find a neurosurgeon who has experience treating and managing this disorder. It's very important to find a neurosurgeon or a neurologist who specializes in only Chiari or is a true Chiari specialist. This way you're able to get optimal care and up-to-date treatments. Most of the time, symptom management is the main course of action. This would include medication management, pain management, physical therapy, occupational therapy, speech therapy, occasionally steroid injections, nerve blocks, nerve stimulator implants, or sometimes pain pump implants as well. If all else fails, though, the only other option will be surgery. And the next slide's a little graphic, so if you don't want to look, you don't have to. The most common surgery that is performed is considered the posterior fossa decompression surgery. This is whenever they make a 6 to 8 inch incision on the back of your head, open it up, and they create what is a sling or a hammock to hold your brain up and off your spinal cord. They make this with a Dura patch, or sometimes they'll use a graft as well. The Dura patch is actually, they take the Dura, the membrane of your brain, they remove a piece, and they actually create the hammock. Other times they'll use muscle or cartilage from your thigh, rib, neck, or ear to have the same effect. The other variations would be considered a a shunt that's placed and it comes from behind the ear into the stomach and drains the spinal fluid. Another alternative would be to have removal of all or part of your C1 and C2 vertebrae and have it fused. Removal of the cerebral tonsils entirely is the last step for the surgery. The surgery itself is not a cure, it's simply a means to slow or stop the progression of this disorder. There's a very high percentage of surgeries that will fail or will need to be redone 2, 3, 4 more times. So, Chiari is a very complex disorder that I feel strongly about because I personally suffer from it. I've been fighting it for 4 years and I am going to have the surgery as I described. The medical community has come leaps and bounds and has a much better understanding today than they ever had. Due to this, the surgery itself is much less invasive, as scary as it seems. So, MRI is the only way to diagnose, so if you have any of the symptoms that you've seen, it never hurts to have it checked. Awareness is needed to be able to fight this disorder and to be able to find a better cure than having something barbaric like the surgery that we discussed. So, Chiari Awareness Month is September, which is why I picked this. Also, Chiari's color is purple, which is why all my slides are purple. So, all I ask is that you spread awareness, talk about it, kind of gain that knowledge out there, and wear purple. So, thank you.